VP Steve.
Yes, President. Good evening to you, and good evening to everyone, our fellow Kiwanians and guests who are here this evening. Looking forward to, as usual, an exciting and invigorating Kiwanis Club of Kingston meeting. At this juncture, we're going to celebrate anniversaries and birthdays for Kiwanians who are members of the club, but I'll also extend it to other members, other Kiwanians who may be on the call or virtually. So this is for the week of Monday, April 24th through May 1st, next week, Monday. We have quite a few Kiwanians and their wives celebrating both birthdays and anniversaries. First of all, past Chairman Dr. John Soas, Dr. John as he's affectionately called, he celebrates his birthday on the 26th of April. That's a greeting to him. Also, DP Charles Sims celebrates his birthday also on the 26th of April. When we roll around to the 28th of April, Kiwanian Von Garwin has his wedding anniversary on the 28th with his wife, Colleen. I'm not sure how many years they are, but please extend wedding anniversaries to them. Also on the 28th, past Chairman Anura and his wife celebrate their anniversary on the 8th of April also. And then finally, Kiwanian George Beckford and his wife celebrate their birthday, their anniversary on the 29th of April. His wife Alicia is on the 29th of April, so special anniversary greetings to them. Is there anybody else who is celebrating a birthday or anniversary that they'd like to share with us at this time? Okay, if not, I wish everybody a productive and a positive week, Kiwanians and guests. And as everybody is, I'm looking forward to an informative presentation later on. Back to you, President Junior.
And thank you. I just remember my wife's birthday was on the 20th of April.
Oh.
The last week on, right?
Last week, yes. I hope you remember, though, President. I assume
I did. That's why I remember.
Okay. That's why you're reminding us all.
Yes. Okay, thank you. Thank you.
You're welcome.
Yes. So we'll move to our next item, which is Kiwanis education, which will be done by no other than LGD Desmond. LGD?
Thank you, President Junior. Good evening, everyone.
Good evening.
Today is on elections and vacancies.
Right. Very appropriate.
Qualified and consenting members may be nominated in advance or from the floor at the annual club meeting. By being qualified, you have to be in good standing. After elections are held, there's a vacancy in the office of president, the president-elect, or the IPP, that's the immediate past president, or the vice president may fill the position, or as may be stated in mandatory policy of the bylaws. For all other officers and directors, new elections will be held within 60 days, provided at least 14 days prior notice of the meeting and nominations is given to the members. If the secretary was appointed and there's a vacancy, the president will appoint someone to fill the vacancy, subject to the approval of the board. That's it, Kiwanis education, President.
And thank you, LGD. Very appropriate. Tonight, we'll be hearing some more about this later on, our reports and nomination. Okay? Okay, so here we are at the main event. And tonight, we will have our own Kiwanians, Dr. Andy John Baptiste, who will be leading this discussion tonight. Very interesting discussion. and health issues. And that is below the belt. Whatever that means, we'll hear about it in a little while. Just before though, we are going to be asking DP Chairman DP Stewart to introduce our guest speaker. As I've said before, our own Dr. Andy Jean Baptiste.
Thank you, President Junior.
Yes.
Fellow Kiwanians and guests, it is my pleasure this afternoon to introduce our guest speaker. And let me just, I also want to keep it simple. He is Andy Samuel Jean Baptiste. He's a St. Lucian national who graduated from the Latin American School of Medicine in Cuba. After the completion of his undergraduate studies, he worked with the Ministry of Health and Wellness in St. Lucia, specifically at the Victoria Hospital in Castries. Dr. Baptiste served a 3.5-year tenure at the Victoria Hospital and was attached predominantly to its accident and emergency department. He subsequently served in the Department of Internal Medicine at the University Hospital of the West Indies for 4 years. He has a passion for internal medicine and a special interest in geriatrics, which is a subspecialty of the discipline. He currently practices privately as a general practitioner. And I just want to add another little word. Kiwanian Andy is a recent inductee into the Kiwani School of Kingston. And I reached out to him a little over about a month ago, asking him that said I wanted to co-opt some select members to help to work on the club meetings committee. So I would appreciate, and he said he agreed, without any hesitation. So I said to him, okay, put some ideas down for me that you think, might work. And so he put together some of the ideas that he had thought of. And tonight we're gonna hear one of his ideas. So I want the audience to be aware of it. When I looked at it, I said, I thought this was something that could be of value. And so it's in that context that I want to also commend him for putting his foot forward and accepting the invitation to be a part of this committee, and also to present himself as well in terms of what he's gonna do tonight. So with that, having said that, Dr. Andy Jean Baptiste, it's over to you. Thanks again.
Thank you very much for the introduction, and thank you for the opportunity to share this evening. Can I be allowed to share?
Sure. You should have. Let me just give it to you. Although I think you had the option to do so.
It's open.
Yeah, it's open.
Okay. Okay, good night, everybody. Tonight's topic is below the belt. And it's a focus on, let me just get to read height, fruiting controls. It's a focus on men's health. Now, just an icebreaker. A patient was commenting to his friend that he had seen the doctor and said to him that the doctor said that he would have had him back on his feet in 2 weeks. And his friend, curious to know, said, "And did he?" He said, "Yes, I had to sell the car to pay the bill." I pray that no such doctors existed here. All right, the objective of tonight's meeting is to demystify why men don't like going to the doctor, to create a greater awareness of health issues in men, and to encourage healthy habits and lifestyles. Now, there are some social factors that have impacted on the man and his health. We know that the very nature and nurture of men has influenced his attitude towards health. If he's coming from an environment or a household where being proactive regarding health is a thing, then he's more likely to follow suit versus an environment where there is a nonchalant approach to health. We know from biblical days, the man has been called to be the provider. Society has taught that he's called to be the provider. He's supposed to be a pillar of strength, defender and protector of the home. He's supposed to always be emotionally strong, not supposed to be fatigued or show any sign of weakness or even sickness thereof. And it has been shown constantly through time. And even when we consider soldiers, back in the earlier days, soldiers were actually left behind because they were thought to contribute to slowing down the pack or causing the group, to function less optimal. So the Huffington Post in 2016, they did a survey over a 2-year period just to find out why exactly men don't like going to a doctor. 52% actually said that nothing would keep them from making an appointment to see the doctor. But of the 48%, what you see now is the result from the survey and the reasons why they opted not to go to a doctor. And I should also say that participants were allowed to choose whatever reason they identified with. 22% said that they were too busy to go to the doctor. 21% said that they were afraid of finding out if anything might be wrong. 18% complained of getting uncomfortable body exams, and we know especially for men, it's the dreaded rectal or prostate exam. 8% said that the questions were too personal. 7% were afraid of getting weighed, and another 7% didn't want to get naked at all. 4% complained that the room was too cold, and 9% had a reason that was not previously identified. Now, below the belt, for those of you who watch boxing or have watched professional wrestling, although more so we realize that in WWF and WWE, you realize that very often persons tend to go below the belt. And in true sportsmanship of boxing is actually frowned upon, and it's regarded as not being sportsmanlike. It's an issue, and it comes with a penalty for persons who actually strike below the belt. So if in sports there's such great regard for targeting below the belt, we can understand and appreciate how important or how significant matters below the belt supposed to be to us men. And like I usually tell my male patients, for me, even as a doctor, I mean, putting a doctor aside, I'm first and foremostly a male. Anything below the waist for me is an emergency. And tonight we want to create greater awareness of health issues arising below the belt. I think I've gotten my slides a bit mixed up. All right, so one of the things that I wanted to focus on is the prostate. Now, the prostate, oftentimes a patient may have an enlarged prostate, most times determined based on physical exam and based on symptoms or signs that that patient might present with. The prostate is a small walnut-shaped gland in males that produces a seminal fluid that nourishes and transports sperm. prostate cancer is one of the most common types of cancer in men. Some types grow slowly and remain confined to the prostate gland where they may not cause serious harm. Other types are more aggressive and spread quickly. I got my slides mixed up just now. In terms of the location of the prostate gland lies just below the bladder, and it actually surrounds the urethra. The urethra is this hollow tube that leads from the bladder through the prostate and to the glans penis, commonly called the head of the penis. So that small orifice that you would see at the head of the penis is actually the meatus. It's the opening of the urethra. So the following pathologies are actually associated with an enlarged prostate. Now, to the left here, we would see a normal prostate. As we said previously, the prostate is this walnut-shaped gland to the base of the bladder, right? And it goes around the urethra. When this prostate enlarges, right, it actually compresses the urethra, this hollow tube where urine can flow freely, no longer flows freely, right? When that happens, it can actually cause decrease in the force of the urinary stream. So men, you would recall that when you were a boy, you were able to urinate and your urine would shoot and shoot very far. But when the prostate is enlarged and obstructs the free flow of the urine, the force of that urine stream is not as strong as before. Patients may feel a constant need to urinate because every time they urinate, the bladder no longer empties completely because it's now obstructed. There might be dribbling after you finish urinating. So you've urinated, and normally men after urinating, we shake the penis to get rid of the urine that might still be in the urethra. But even after shaking, there is a constant trickle of urine. This is called dribbling. For some men with enlarged prostate, they might actually have a difficulty initiating urination because they have to now push harder and bypass this obstruction so that the urine can flow freely. One of the pathologies that come with an enlarged prostate is a prostatitis. Now, the section of this word itis, itis means inflammation, and prostatitis is simply the inflammation of the prostate gland. When that occurs, urination becomes very painful. The patient might also have pain in the groin, the pelvic area, and also in the genital. Now, most commonly, the cause of prostatitis is usually bacterial in nature. There's an entity called benign prostatic hyperplasia, and all that simply means is that the prostate gland is enlarged and not cancerous, right? Enlarged and not cancerous. The symptoms are pretty much in keeping with what we previously explained because it's an enlarged prostate and the effects are similar. It will block off the urine, cause incomplete emptying of the bladder. You may have to force more to urinate. You want to urinate very frequently, and you would experience some dribbling. Now, with factors that can affect or influence one having benign prostatic hyperplasia is aging. As you age, in most persons, the prostate tends to become larger. Family history. If there if there is a history of prostate problems, sorry, particularly an enlarged prostate that is not cancerous, right? Then one is likely to have the same because of genetic predisposition. Doesn't mean that they definitely will have, but just means that they are likely to have an enlarged prostate of a non-cancerous origin because of the family history. Diabetes and heart disease have been shown to also contribute to an enlarged prostate. Lifestyle, and under lifestyle, obesity actually raises the risk of having benign prostatic hyperplasia. And exercise and dieting appropriately can help to reduce that. Want to touch on prostate cancer? Or before I go off to prostate cancer, this slide was done already. Want to go across to prostate cancer. Now, prostate cancer in of itself, it's simply an abnormal growth, a tumor within the prostate gland. Depending on the extent of the tumor in this gland, you can have symptoms of obstruction as we previously described. Among the factors that affect or factors that predispose one to have prostate cancer, age. Prostate cancer is more common in the older age groups, and it does not mean that because you're elderly or up in age that you automatically have prostate cancer. That's not the case. Race. Now, for some reason, it has not yet been determined, but for some reason, Blacks are more predisposed to have prostate cancer. And they're not only more predisposed to have prostate cancer, but prostate cancer among Blacks tend to be more aggressive. And usually at the time of diagnosis, it may be very advanced. Family history, again, we're talking about genetic predisposition. If there is a first-line relative, father, sibling with prostate cancer, it puts you at high risk of having prostate cancer. Studies have also shown that for men who have first-line or first-degree relatives who have breast cancer, or actually have the BRCA1 or BRCA2 genes that code for breast cancer, there is a strong risk of having prostate cancer. And of course, obesity in of itself puts you at higher risk of having prostate cancer in comparison to persons who are slimmer, all right? And I really want to drive that home regarding obesity. We know that lifestyle modifications can contribute to obesity, whereas it's also true that genetic makeup and hormonal issues can contribute to obesity. And I'm stopping here to emphasize on obesity because where it is possible to modify one's lifestyle and contribute to a decrease or a resolution of one's obesity, it should be considered, and we should not take it lightly. Sadly, in our society, I think that not much emphasis is given to obesity. We don't see it as an illness, and it's actually an illness. So common symptoms associated with prostate cancer: having trouble urinating, as we said before, decreased force in the urine stream. One may have blood in the urine or blood in the semen. A bone pain, especially when the cancer is no longer confined to the prostate but has extended to the surrounding bones. Losing weight, losing appetite, erectile dysfunction. Prostate screens. I want you to focus particularly on this image to the left here. Soldier goes to the doctor with gun in hand, says, I think we can skip the prostate exam this year, doc. And this is the approach, or this is the sentiments that a lot of men share towards having a prostate exam. Now, while it is true that both a digital rectal exam and a prostate-specific antigen, commonly called PSA, which is a blood test, can give information regarding the prostate, there is benefit in both of them, and neither is more superior than the other. Why do doctors like doing a prostate exam? As we see here in this image to the center, we see the prostate gland here. This is the bladder here, the prostate gland, and the rectum. The prostate gland is actually in close proximity to the rectum. By simply putting in a finger, the doctor is able to appreciate the size of your prostate, to determine the texture of the prostate. Is it hard? Does it feel like there are nodes in the prostate? All right. When the doctor does the exam, does it provoke any pain in the patient? And all of that is important because you could actually have a patient with a normal blood test, a normal PSA, which does not tell you if a prostate is enlarged or not. Another reason why your doctor would need to do a prostate exam for you. Doing the prostate exam allows him the changes in texture, whether it's nodular, hard, or soft, allows him to determine, okay, if I have an enlarged prostate, is this cancer or not? Often in prostate cancer, the prostate gland is indurated and tends to be nodular. Is this prostate enlarged, and is it also tender, which is common in the case of prostatitis? And I'll have you know that there are times where men may be asymptomatic of their prostatitis, or it's only on examination of the prostate that they actually realize that they have pain going on down here. Oftentimes, men tend to dread the prostate exam because the doctor might not be as gentle as he should be, especially in the case of a doctor who has large hands. It could be very uncomfortable for a patient. But suffice it to say, we know that naturally things only come out of the rectum. While it is true that the prostate exam actually causes some discomfort, and for some it may cause pain, it is what we like to refer as a necessary evil, because lots of information can actually be derived from the prostate exam. Regarding the prostate-specific antigen, this is a protein which is produced by the prostate gland under normal conditions. It's also produced by malignant cells. It's usually elevated in the presence of prostatitis. And if you recall, we said that prostatitis is the inflammation of the prostate gland. And it's also elevated in BPH, which is benign prostatic hyperplasia, non-cancerous enlargement of the prostate. It's, however, markedly elevated in the presence of prostate cancer. Now, you can understand and appreciate that a doctor having an elevated prostate exam, he cannot differentiate through the myriad of pathology that can be happening at the level of the prostate. And hence why we emphasize that a prostate exam, although uncomfortable or maybe painful to the patient, is a necessary evil because it offers lots of information to your physician, and information that helps your physician to give you the optimal care and to contribute to your improvement health-wise. Now, who should be screened for, or who should have a prostate test? I remember that my doctor back home is actually a urologist. He just happens to be a urologist. And I remember presenting to him, I was 19, 20 at the time. And there was no reason, absolutely no reason why at 19, 20, I would have warranted a prostate exam. And I had a prostate exam. Now that I'm a physician, I consider it an evil in of itself because there was no indication. But understanding that this man is a urologist, I guess it was befitting of him, being that that was his line of specialty. So men who are age 50, for men who are at age 50 and greater at average risk of having prostate cancer and expected to live at least 10 more years. Men who are age 45 and are at risk of developing prostate cancer. This includes African Americans. As we saw before, we saw that African Americans are predisposed to have prostate cancer. So having that as a risk factor, once you're greater than age 45, you definitely should have a prostate exam. If you have a first-degree relative diagnosed with prostate cancer, at that age, you certainly should have a prostate exam, even if you're not of Black ethnicity. And certainly, if you're younger than 45 and you have a first-degree relative who has prostate cancer, you should also be tested. I want to move on to the testicles. Now, the testicles are simply egg-shaped glands inside the scrotum that produce sperm and male hormones. The testicles are also called the testes. Now, we've often heard of the breast self-exam. Men, if you didn't know, now you know. There is a testicular self-examination. And doing a testicular self-exam offers a lot of information, and it could actually alarm you to changes in your body. Now, in order for us to know what is abnormal, we must first know what is normal. The ideal time to do a testicular self-examination is when you're in the shower, right? You're in the shower, you're by yourself, you don't have anyone to disturb you, or neither do you have anyone to walk in on you and make you feel uncomfortable in the case where you live with other persons that you might not necessarily be very comfortable with. And besides, if in the shower you're already naked at that time, so it puts you at the ideal time for you to go ahead and have that examination. And we know that when you have showered, especially with warm showers, the scrotum tends to be more lax or stretch, as you may commonly refer to it. And with that, you're able to better examine the testicle. It's usually advised that you stand in front of a mirror to assist in the examination, particularly in persons who are centrally obese, i.e. persons who have very huge. So what you do, most males would be familiar with playing video games, be it a PSP or having a console. The concept is pretty much similar. You're gonna take your thumbs and put them to the front of the testicle, and you're going one at a time, of course. And your index finger, just as your index finger would be to the back of the console, you're gonna slowly go down the testicle, right? And when you do so, you're actually feeling for lumps changes in the size of the testicle or any irregularities. Now, I mentioned irregularities, and I want to emphasize again that to first be able to determine what is irregular, one must know what is regular or normal. Now, there is a tube-like structure that actually connects to the testes. You will feel it attach the testes, that's the epididymis, and there is a cord that leads from that going up, that's your spermatic cord, lest you should not know what is regular. And of course, we're in the era of information where information is readily available. So I want to challenge every man who is here to familiarize yourself with documents. There are videos on YouTube. And of course, ladies, you're not exempt. I want you to encourage the males in your life, be it relatives, friends, co-workers, to familiarize themselves with the normal anatomy of the testes, and so that they can be able to do testicular self-exams. So again, when you do those exams, we're looking for any pain, any lumps, any swelling, changes in the size of the testicle, changes in the texture of the testicle. Of course, by texture, if the testicle feels hardened, if it is softer than usual, if there is any fluid in the scrotum. And speaking of fluid, sometimes there is a membrane that covers the testicle that actually becomes filled with fluid. I have seen patients who are actually pleased when that initially happens because they feel, hey, my testicle is getting larger. But it's not something that should be rejoicing, especially if you're an older male, you've already stopped growing. If you feel that there is a pocket of fluid surrounding the testicle, you certainly should, forgive me, you certainly should be seen by a doctor. It just has to be excused whilst I log out of WhatsApp on wearable, lest I should be disturbed again. Give me apologies. All right. There's an entity called orchitis. Now, all this, as we said previously, itis is inflammation. And orchitis is simply the inflammation or one or both of the testicles. Now, it can be because of bacterial or a viral infection, but most times it's usually a resultant of a bacterial entity. And of course, orchitis is seen more commonly in patients who have sexually transmitted diseases. So persons who have chlamydia, commonly persons who have chlamydia, gonorrhea, you would see them presenting with orchitis. In some cases, it may be caused by mumps. Now, as it pertains here, you see this red testicle, which is a bit more enlarged in comparison to the normal testes to the left. In terms of symptoms of orchitis, symptoms can develop suddenly. You have swelling in one or both of the testes, pain ranging from mild to severe. Patient might present with fever, might have nausea or vomiting. There might be this general feeling of being unwell. And of course, because we said that most commonly it's associated with sexually transmitted infections, there can be a penile discharge associated with orchitis. As I said previously, attached to the testicle, attached to the testes, there is this structure called the epididymis. Now, what is the epididymis? The epididymis is a narrow, tightly coiled tube that is attached to the testes, to the testicle. Now, sperm cells move from the testicles to the epididymis where they mature and are stored. In the case of epididymitis, or epididymitis as it is also referred to as, the cause of infection, the cause of inflammation is usually a bacterial infection, right? And as we said previously, just as in the case of orchitis, gonorrhea and chlamydia are often causes of epididymitis. Most cases, well, let me not say most cases, often a patient might present with both inflammation of the epididymis and of the testes, a condition that is called epididymal orchitis, since it involves both the epididymis and the testes. Symptoms: the scrotum, the epididymis is enlarged. Well, it's more of a sign. Epididymis is enlarged. It is tendon palpation. It may be swollen. The scrotum may be discolored also, in addition to be swollen. Patient has excruciating tenderness. Usually on one side, if it is one testicle that's affected, and in the case where it is both, it would be bilateral. May have frequent need to urinate, may have pain on passing urine, and that could also be because of an associated urinary tract infection. There may be a discharge from the penis if it's due to sexually transmitted disease, and patient can have, depending on the degree of the severity rather of the epididymitis, the patient can have discomfort in the lower abdomen, can have fever because this is inflammation, especially on a background of infection, and can note blood in the semen. Testicular cancer. Now, testicular cancer is a rare type of cancer. In the US, they've noted that it is most common between the ages of 15 and 35. Now, lest the younger men should feel comfort in the age, you're actually at greater risk of having testicular cancer. And as I said, this is information or data coming out from the US. Sadly, I don't have statistics of testicular cancer for the local population. Now, the good thing about testicular cancer in comparison to prostate cancer, testicular cancer is highly treatable even when it is advanced, meaning it has spread beyond the testes. And it doesn't matter what stage one may present at that time, treatment, the prognosis is usually good with treatment. And again, as we see to the left, it's a tumor that is attached or growing out of the testes. Just to emphasize once more, if one is in the habit of actually doing a testicular self-examination, you would be able to pick up this irregular node or this bump on the testes, or pain on the testes, and that would be a red flag that should, and I say that should lead you to a doctor's office, because most men tend to have a very delayed response to help. While still in the testes, there is an entity called varicocele. Now, when you hear or think of varicocele, it makes you think of varicose veins, which are basically enlarged veins. Now, just as in the case of varicose veins, where there is a disorder with the valves in the veins, now valves help for blood to flow in one direction. So the blood flows from the body to the heart in the vein. When the valves are faulty, as in the lower right corner, when the valves are faulty, they don't close and prevent the backflow of blood. So what actually happens is that there is a pooling of blood, there is a backflow of blood right? And that blood pools in the vein and causes a distortion or this irregular and enlarged shape of the veins that lead from the testes to the rest of the body, or going back to the heart, carrying blood back to the heart. When those blood vessels are enlarged, men, what you're actually looking out for is noodles or spaghetti-like structures within the scrotum. So if you're doing your testicular exam and you feel like there are these noodles, ramen-like, just to paint an image or give you an idea of what you should feel, what it should feel like. If you're to feel something like that, you need to see a doctor. In terms of symptoms, a dull aching pain or discomfort is commonly felt, right? And that is usually felt predominantly with standing. Lying often relieves the pain that is felt. You could feel a mass in the scrotum, and as I mentioned previously, that mass may feel like noodles. Some persons describe it like a bag of worms. The testes might actually be different sizes. If it's one that's affected, one might be larger than the other. If it's both, you could actually feel that they're bigger or noticeably smaller, sorry, not bigger than the other. Varicocele can contribute to infertility in men, but it does not mean that every man who has varicocele will be infertile. And in terms of treatment, it's actually surgical intervention. I want to touch on erectile dysfunction. Now, erectile dysfunction is simply the inability to get and to keep an erection which is firm enough for sexual intercourse. Now, having erection trouble from time to time is not necessarily concern. You might find that usually when you wake up in the morning, you might have this glorious rise. One day, for some reason, you might not notice that you have this strong, glorious rise. Some men will report that having a morning erection, and especially if they want to urinate, some men usually say that they have to sit at the bathroom to urinate. I've had patients before who say, "Doc, I have to urinate in the shower and run the water thereafter." But not having that glorious rise on one occasion or one or two occasions is not a cause for concern. If it's a persistent occurrence, then definitely it's cause for concern. And of course, erectile dysfunction can cause stress, affects your self-confidence as a man, knowing that there are responsibilities, especially for, well, let me not say especially for married men, because both married and unmarried men engage in sexual practices. So there is expectation from one's partner that he should be able to perform, and not being able to have an erection that is strong enough or that lasts long enough for sexual activities actually affects the man's psyche, affects his self-confidence, and once that starts to happen, it will reflect in his ability to function from day to day, not just in the bedroom, but can affect his ability to function at work as well. As we said previously, in terms of symptoms, trouble getting an erection, keeping an erection, and there can also be reduced sexual desire. And again, the reduced sexual desire is largely in part because of decreased self-confidence, knowing that these issues are ongoing. Now, in terms of the causes of erectile dysfunction, it can be vascular in nature. There is a great blood flow to the penis that actually contributes to the ability to have an erection. All the entities or the illnesses that affect the blood vessels. So we think we're referring to high cholesterol that might cause atherosclerosis and block off blood vessels, just as atherosclerosis is a problem in the supply of blood to the heart. It would also block off the supply of blood to the penis and affect the ability. Once blood flow is being restricted, we know that blood is not rushing into the blood vessels of the penis as quickly as it should. The blood vessels are not becoming as packed, for lack of a better expression. That column, which is the blood vessel, is not being filled up with blood as it should in normal blood vessel, and prevents an erection from happening. Diabetes is also a contributing factor, as diabetes actually affects the nerves, and there is nerve supply to the penis. So if you have uncontrolled diabetes, that can actually be a contributing factor to erectile dysfunction. Lots of medications, especially blood pressure medication, contributes to erectile dysfunction. Now, some blood pressure medication work by relaxing the blood vessels, and when they relax the blood vessels, constriction of the blood vessel doesn't happen as in comparison to before medication would have been taken. When that happens, the pressure of the blood, just as the blood pressure medication brings down your blood pressure on a whole, the force of that blood, the pressure of that blood that goes to the penis is also reduced. So often patients would say that they stop taking their blood pressure medications, particularly their blood pressure medications, because it causes them to not be able to have an erection. Now, to be quite honest, as a male myself, if something were to cause me to not have, if medication were to cause me to not have an erection, while it is true that I recognize that the medication is causing that, and I wouldn't not want to take something that causes some kind of adverse effects. The ideal thing to do is to not stop your medication altogether, but sit with your doctor, make your doctor, him or her, aware of what the medication is doing to you, and the two of you can come to a consensus as to what medication would be ideal for you, which will treat your underlying condition. And I'm now referring not only to hypertension, but any other medication that's affecting the ability to have an erection. Having now brought that to the attention of the doctor, they're able to change around your medication and give you something that may have less of an effect. Now, there are neurological factors, of course, in patients who, by neurological, we're referring to the nerves. In patients who have trauma, spinal trauma, may not be able to have an erection. While we spoke of diabetes, we did mention nerves being affected. That will also fall into neurological. A component that was not mentioned is psychological. And when we talk about mental wellness, or mental health being underemphasized, you really see where it affects men as it pertains to erectile dysfunction. If a man is overly stressed by day-to-day responsibilities, it's possible that you will not be able to have an erection. Stress not only has had cases where there are marital issues, major arguments, and just because of that, even if there is desire by the wife, the man, because he's so angered by whatever issue that may have occurred before and is still unresolved, not be able to have an erection. Depression can lead to inability to have an erection. And this is why mental wellness, this continues to be a tongue twister. This is why mental wellness or mental health must not be taken lightly. There are endocrine problems, especially when testosterone may have decreased significantly, may contribute to erectile dysfunction. In terms of recommendation, now some of what we've discussed before, there are things that we could actually do to prevent or to diagnose early these entities. I want to emphasize that prevention is always better than cure. Prevention is always better than cure. And we spoke of obesity being a risk factor for having BPH and having prostate cancer. And simply because obesity, it contributes to an increase in insulin growth-like factor, which actually molecular substance that can actually contribute to abnormal growth of tissue. Exercising in conjunction with diet actually contributes to decreased weight, which decreases the likelihood of you being obese and favors not just that, but as it pertains to hypertension and diabetes that can affect or be a risk factor for benign prostatic hyperplasia, BPH, and also contribute to erectile dysfunction, and also exercise and dieting contributing to lowering of your overall cholesterol levels so you don't have atherosclerosis and don't have blockage of your blood vessels, not only at the level of the heart, but also at the level of the blood supply to the penis. Compliance with medication, if one is on medication and restrictions. If you're on hypertensive medications, don't say that you're tired of taking your hypertensive meds, because if you have uncontrolled hypertension, as we saw previously, having uncontrolled hypertension, having uncontrolled diabetes are risk factors to BPH and to erectile dysfunction. If you're supposed to be restricted in terms of your salt intake, restricted in terms of your diet, please follow suit. Keep scheduled follow-ups. In as much as men, we can understand and appreciate if men don't like going to doctors, they're certainly not going back once they feel well. And that is a big no-no. Seek support. Now, sadly, earlier on, I spoke about social impacts and I spoke about nurture and nature. A lot of those illnesses are usually things that men will not feel comfortable disclosing to each other. But there is no shame in having or identifying somebody who can support you as you go through whatever process, be it affecting your prostate, affecting your testes, whatever it is. Find at least one person to confide in, one person who can encourage you as you go on this journey, knowing that health tends to affect psyche and that can lead to depression. So you definitely want to seek support. And there are lots of groups. You'll be surprised how many support groups there are online. There's a support group for everything. And just as in Alcoholics Anonymous, you could actually get information from persons who are struggling with the same condition as you. And that is encouraging in of itself to be able to weather that storm. It's mango season, and I put up this picture for a purpose. I wanted to see and note that even on this tree, it's probably not the nicest mangoes, and one might say it pretty much looks like a common mango, but this is not the focus of this image right here. There are green mangoes on the tree, and likewise this ripe mango. But take your eyes to the bottom of this mango tree. There are some mangoes we see are notably green, while others are ripe or even brown, rotting. In St. Lucia, it often says that green mangoes leave ripe mangoes behind, which means, sorry, let me take that back. Ripe mangoes leave green mangoes behind. And what the gist of this saying is that sometimes younger persons die and elderly persons who are thought to be more likely to die off because of their elderly age or their fragile condition being less vibrant. And this is a warning to the younger men that you're not exempt regarding issues pertaining to the prostate and the testes. And just to drum into your hearing once more that even with testicular cancer in the American population, it was the younger age group that was affected, 15 to 35. A stitch in time saves 9. And in this picture, we see this woman literally sewing a patch onto this man's pants. The size of the hole, we don't know, but she's sewing nonetheless. And ladies, I'm happy that you're connected tonight. Just as this woman is stitching the pants of this gentleman, I want you to be the reminder, that gentle push or gentle kick, even if it's necessary and comes to that, to the men to be more proactive and more serious as it pertains to their health. And men, for us, early intervention, early detection, prevention can help us avoid major complications or help us to have early resolution of whatever conditions that we may have below the belt. So this has been a brief summary of some conditions below the belt, and I trust that it has been easy for you to understand and everybody leaves here edified at this time.
Thank you, Andy. That really was comprehensive, and rather than me saying anything more at this stage, I want to quickly open the floor because I'm sure there must be some persons who have questions. And remember, when you ask a question, it doesn't have to be your issue. Let's free it up. You can know somebody who has a particular situation. So don't want you to feel that if you raise an issue, people are gonna say, "Oh, that's your problem." So let's
I see LG Hughes hand up.
Okay,
yes.
Thank you. Okay, LG Hewitt, go ahead.
Yeah, let me first of all thank Dr. Baptiste and assure him that his presentation was very easy to understand, and commendations on that. My question is, and there's a story, I don't know whether it's apocryphal or not, but there was a story about a past Prime Minister of Jamaica who got prostate cancer. And when given the choice between the surgery and losing his potency, he decided to take his chances with maintaining his potency. Of course, he died from prostate cancer. So my question, Doc, Now that technology has advanced, and I understand that there are technological improvements in terms of prostate surgery, which will preserve nerves and your ability to function. How much of a risk it is for men who have to do prostate surgery that they will become impotent?
So, as you rightfully said, technology has advanced, and with that advancement also medicine has evolved. And in comparison to olden days where they would radically remove, in the case of prostate cancer, radically remove the prostate, there are now procedures or techniques that allow for sparing of the nerves, which do allow for men to have erections. There are also other treatments for prostate cancer. I guess it's all case by case. It's all case dependent rather. And in the case where patients may have chemotherapy or radiation therapy, the ability to have an erection may be preserved also. But suffice it to say, and again, I'm putting off my stethoscope to identify as a man. First and foremostly, I am a man. While it is true that the ability to have an erection is important to us as men, you have to also consider, do you want to forego treatment and actually wax and wane away with the complications of prostate cancer, if it is in a case where you're in an environment where you cannot be offered nerve sparing intervention? So it's something that needs to be considered. Kudos to technology, advances to technology and being able to spare the nerve, but it boils down to, is having an erection more important than life? And when you consider not only yourself, but your loved ones, is your wife ready to be, or your spouse ready to be alone, children ready to be without a father, it makes you put things into perspective and make a more guided decision in that regard.
Thank you.
Thank you.
I see Crystal Heaven hand up. Nice to have a woman.
I'm seeing somebody else. I'm seeing a Michael Redwood first.
Yeah,
Isn't
but
that...
I know, but since we had a male before and it's
No, it's okay. Let's just take it in sequence. She'll get her turn. Go ahead. It's easier for me to follow it this way. Go ahead, Michael. Oh, it's Marshall.
That's your Marshall.
Marshall. Yes. Okay, okay. Let's go to Crystal then. He's not quite ready. Crystal, go ahead.
Sorry, I muted my mic, but you can go ahead, Crystal.
Okay, go ahead, Crystal.
Okay, Marshall, thank you so much. Good evening, everyone. For you, Doc, a quick question. Are there any over-the-counter drug that can temporarily fix the problem?
We discussed many problems. Which problem are you?
For the erectile dysfunction. How about a friend on the other line? So,
there are some herbal therapies that reportedly contribute to improve erectile dysfunction. Whether or not that is true, like honey goatweed, I think that's one of the herbs that are reportedly improves erectile function. I don't have statistics on that, but most drugs are not usually over the counter. Yes, some persons have access to Viagra without a prescription from the black market and other illegal means. To my knowledge, Viagra is popular. I mentioned Viagra because it's one of the most popular drugs. It's not an over-the-counter drug in Jamaica. But I want us to always err on the side of caution, especially as it pertains to treatment for erectile dysfunction, because as we saw previously, the causes can be due to medication, and in that case, if you stop medication, the offending medication that is, then erectile function should return. So in that case, you don't need to purchase anything. If it's in the case where it's something psychological, somebody may have been livid from an argument or is depressed, just having a counselor, somebody to speak with and change your whole outlook on the situation or on life in general, that can contribute to improve erectile function. And I'm saying all this to mean that in order to treat erectile dysfunction rather, it's important to know what is the cause of said erectile dysfunction. So one really and truly should speak with a doctor. Regarding medications that are available on the market, be it black market or regular, it's also important to know if there's any interaction with medications that patients might be on. I remember in my younger days as a physician, I had a patient who came in sweating profusely with chest pains, and we thought this man may have had a heart attack. Only when we went further into the history, he had actually taken a pill, an enhancer for his erectile dysfunction. So you want to be very careful with medication and possible interaction with
1 gallon or 2 gallon, whatever he needs.
and
Hello.
possible interaction with other medication that one might be taking.
Okay, thank you, Doc.
Welcome.
Okay, Marshall, your time. Marshall?
Thank you very much. Are you hearing me loud and clear?
Yes, we are.
Thank you very much. Yeah, good night, gentlemen and ladies. All right, so I know personally of 2 gentlemen who died of prostate, and I also know their wives. And their wives told me that their husbands were unfaithful, so they denied him that diamond that we all crave for. So you know my question, right?
No, I don't actually.
Sure. All right. So the question is lack of sex one of the reasons that can cause prostate cancer?
To my knowledge, it is not. I have seen some articles that state that ejaculation actually reduces the risk of prostate cancer. But again, medicine has evolved and we practice based on evidence. We practice evidence-based medicine. And whilst that theory is postulated, there is not enough to determine that ejaculation contributes to improve prostate health overall.
But the verdict is still out though. I mean, you don't have enough evidence to say yes, it is.
The verdict is still out. Bear in mind that the thing about information, the population that is being studied needs to be considered. If I get a sample size of 10 men and say these men all ejaculate at least once daily, be it through regular sexual intercourse or other means, versus a study that has a few hundreds or thousands of men, that actually makes your study more credible and reliable. So though some theories are postulated, we haven't had sufficient to actually clearly state that having more frequent sexual intercourse actually contributes to improve prostate health.
Okay. Thanks for the question, Marshall.
Sure, thanks.
Director Warren, you're next in line.
Thank you, Chairman. I too would like to commend the Dr. Baptiste on his it's very clear talk tonight. I think he really simplified the issues, and I think most of us have a better understanding of below the belt, you know. But I would like to get his opinion or his perspective on, and he gave a little talk on BPH. And I wanted to get his perspective on two procedures that I've heard about to deal with BPH, especially when it's restricting the flow of urine, you know, and that is TURP and HOLEP, TURP and HOLEP. These are two surgical procedures.
Please keep your mic on mute until you are actually speaking to us. Thank you. Go ahead, Warren.
Yes, so those two surgical procedures, I made to understand are what are used to alleviate the problems caused by severe BPH. And I just wanted to get the perspective of the goodly doctor to get his opinion on it.
So I am familiar with TURP, but I don't think I would be the best person to give an opinion regarding the efficacy or the risks associated with the two procedures. Ideally, a urologist, one who specializes in the urinary tract and reproductive organ, would be able to give more information as it pertains to which procedure would be most ideal for the patient. And of course, in medicine, everything is case by case dependent. So in conjunction with your urologist will be able to offer or indicate as to which procedure would be most ideal depending on the extent of enlargement of the prostate.
Okay. Thank you for that response. There is a question in the chat. Let me read it. It's just requesting views on proton therapy versus targeted radiation versus prostatectomy.
So we know that prostatectomy actually removes the prostate altogether. And as one previously indicated, back in the day, one of the common side effects of prostatectomy was actually not being able to have an erection. But medicine has evolved, and with the evolution of medicine, persons are actually able to have preservation of the nerves and actually be able to retain erectile function. Targeted radiation, there is what is called seedlings, where radioactive substances are placed within the scrotum, within the testes, and serves for a period of I think every 10 years. It's within 10 years, it covers a 10-year period. I recently had a patient actually who received care in the US and had radiotherapy and seedling, and is doing quite well. As a matter of fact, his only concern now is he's having a bit of obstructive symptoms because the prostate is still enlarged. He's having a bit of symptoms with urinating, the urinary stream not being as forceful as before. and there's actually medication to reduce the size of the prostate, but has actually had preservation of his erectile function. Regarding proton therapy, I'm not very savvy regarding proton therapy and wouldn't be able to speak to that.
Thank you.
Chairman, did you see my hand being raised?
Oh, no, I didn't see it. I didn't see it. It's not, there's no, I don't see the hands up. Even though I don't see the hands up. But I'll come back to you then, Jude. So now that I know you want to ask a question.
Okay.
Let me just get through this. Yeah. In terms of the digital versus PSA, most people would have tended to assume that if your PSA numbers seem okay, then you don't have anything to worry about. But I'm glad you pointed out that the digital exam can reveal things that the PSA wouldn't. But one thing you didn't say though, what kind of frequency would you recommend? And I guess it might depend on age as well, but could you speak to frequency?
There was actually a slide indicating frequency. Well, I think I mentioned that the years with which you should be screened. If you're 45 and older, you definitely should have a prostate examination yearly. If you're less than 45, but you have a first degree or first line relative, be it father or sibling with prostate cancer or strong family history, you definitely should be having a prostate exam done yearly.
Okay, I think I just missed the part about yearly. So what you're saying is once you're over those ages, you should be doing it on an annual basis. That's the point. Okay, thank you for that. President Junior, your time.
Dr. Andy.
Yes,
excellent
sir.
presentation.
Thank you.
As I enjoyed. But I'm just one very simple question. Can prostatitis lead in any way to prostate cancer?
There can be prostatitis can be chronic, meaning it can, if untreated, or it can be recurrent, last a long time. But I am not 100% certain that it can lead to prostate cancer. One would think, though, that because it is so, because of the pain associated with prostatitis and on urination as well, that one would seek immediate intervention and medical attention, and that it will not lead to an extended period of time. While it is true that there are persons, because of other entities, may have chronic prostatitis, but in most cases, especially where it's associated with sexually transmitted diseases or viruses, you have a short course of prostatitis.
Okay, thank you.
Okay, we are just about to close, but if you have one or two more who really want to get in a quick question, we'd allow that. But you'd have to come quick.
Be careful what you're saying.
Oh, all right. Bad choice of words. Okay. All right.
MC on fire.
Yeah.
Is there somebody who?
Yeah, talking about coming quick. We want to find out concerning the type of foods that probably would help the stimulation to be maintained. What would you suggest, sir?
So I'm not sure that there are foods that actually help stimulation, but what I can propose is the following. There are exercises called Kegels. You know, when you urinate, you're actually squeezing the muscles of the pelvic floor to force that urine out. You can do Kegels It's something that you could do at any time, anywhere you are. You could be at your desk typing a note and you're just doing Kegels, nobody is seeing. You can be in your car driving, or when you're pressing gas, pressing brakes, you can do it. And that helps to strengthen the pelvic floor and be able to retain or delay rather ejaculation. Of a fact, we know that ejaculation is resultant of stimulation. So if one has a particular event or this, whatever the reason being that he wants to last longer, masturbation before the act, the actual significant sexual act, can actually delay a second ejaculation.
Okay, that's okay. I think that's Marshall again.
One question real quick, Doc.
Yes,
If
go ahead.
if the prostate is slightly enlarged, right? What do you recommend? What's your recommendation?
Okay, so as we saw previously, an enlarged prostate can be absolutely anything. In a case where a prostate is enlarged, and of course in the absence of signs or symptoms that would lead to the thought process of prostatitis, we now have to determine if that enlargement is non-cancerous or cancerous. So ideally what you would have, referral to a urologist to have a biopsy. The biopsy would actually be able to tell us if this is the presence of cancerous or non-cancerous enlargement of the prostate. And of course, based on whether it's cancerous or not, that will determine what is the management moving forward.
So in the event that it's non-cancerous, what do you recommend, Doc?
So in the event of non-cancerous enlargement of the prostate, that would be benign prostatic hyperplasia. There's actually medication available that can reduce the size of the prostate. And with the reduced size of the prostate, that actually improves the symptoms that come about because of obstruction of the urethra, right? So again, in conjunction with your doctor, many cases now, general practitioners actually prescribe medication to reduce the size of the prostate. But again, it's important that testing is done to determine if it's both non-cancerous or cancerous.
Thank you, Doc.
Welcome.
Okay.
A quick one, DP. Another quick one.
Okay.
Oh,
all right. Let Earl go first.
Go ahead.
Go ahead, Earl.
Right. I'm just wondering, Doc, was there ever a survey carried out as to the age that, let's say, as normal as man could be, an age that you shouldn't be worried if, well, I mean, you don't have erections? Is there a survey that would show, okay, somebody is 80, they're not supposed to be having high expectations, 85, even less. But up to what age when does one really get worried if they thought they were living normal? I hope I'm as broad as I can.
I don't have actual statistics, but I bet you there is a survey out there. But I would say this, there are accounts of men even in their 70s and 80s who actually father children. So when they say age is a number, age, yes, we know that some things decrease with age, but a 70-year-old is not a 70-year-old all around. And depending on your level of physical activity, there are some 70-year-olds who are even stronger, way stronger than some of us younger men. So it's a case-by-case basis. I will say though, as you age, it's anticipated that, as testosterone decreases, as you age, we know erectile dysfunction tends to come about as you age. But certainly, here is an opportunity to speak with a physician who can sit you down, analyze all the possible causes, because it might not necessarily be age, it might be another entity in your advanced age that's contributing to your erectile dysfunction. So to answer the question, while it is anticipated that with age you lose some erectile function, it's really a case-by-case basis to actually stamp hard and fast on an age. But I'm certain that there are probably surveys out there, and you'd have to consider likewise the population in which these surveys are done.
Yes. Race and so on. Yeah. Thank you.
No worry,
Good.
Earl.
Yes.
Okay.
Doc,
And
Yes, sir.
Yes, President
Yes.
Junior, your time.
yes,
Go ahead.
yes. I heard earlier Doc spoke about in answering a question, the exercise Kegels for ejaculation. But I was told about it when I was having problem, for example, with prostatitis, to prevent you from urinating before before it is comfortable to do so. The tendency, they say, is you tend to frequencies. So
Right.
you could do the exercise. Is it the same exercise?
It's the same exercise,
Yes.
because what it does is the same ability to hold your urine until you get to a place where you're able to urinate is the same exercise to delay the ejaculation.
Okay, thank you.
And somebody had written in the chat that some uncircumcised men actually have later
Delayed. Then as they get older
delayed
now, they have.
ejaculation. And again, that's because the glans penis or the head of the penis, as it commonly calls, that is the point of stimulation. Now, when it's covered by the foreskin, then it's more sensitive. But if you have somebody who is uncircumcised, over time, that glans penis or the head of the penis constantly rubs on boxer or rubs on pants, then it's not as sensitive to stimulation or
makes sense
as before.
I'm giving you advice.
Doc, it has been said, I don't know if it's just a cliche, that the greatest sexual, hold on now, is it stimulant or organ? Is your brain, your head?
Which head?
No, no, this time we're not going below the belt. I mean, in
Right.
terms of it, a lot of what is really can be a problem is really in the head. Just would you like to just give a quick last comment on that? And we
Yeah.
It is true, and as I emphasized previously, there is not enough emphasis placed on mental wellness and mental health. One's psyche, the issues that are happening with a man at any particular time can affect his ability to perform.
Yeah.
Whether he is under stress at the home, in the workplace, all of that. If he's overly exhausted, burnout syndrome, all of these can contribute to the ability to perform.
Yes.
So some things are definitely in the mind, and that's why we say again, instead of rushing to get medication, we first and foremost we need to identify what is the contributing factor to erectile dysfunction and treat that particular factor. So in the case of somebody who is depressed, somebody who is under a lot of stress at that time, once they've gotten some kind of support system or even medication if necessary, then they tend to do better
normal.
regarding erectile dysfunction. Yeah.
Okay, thank you very much, Dr. Baptiste, and really, really comprehensive.
Yes.
I had DP Dalma down to do the thank you, but I didn't see his name. I don't know if he has shown up if he's online, can you tell me if you are on, Dalma? But I had a plan B if, you know, okay, it doesn't seem as if he made it. I'm gonna go to PE Newton, who did come online. And I have asked him to stand by to do the thank you. So PE Newton, your time.
Thank you, DP Stuart. Good evening, everyone. And again, I feel great and honored to be the one asked to give this thank you on behalf of everyone online tonight to Dr. Andy. I mean, it was really a great presentation. And I took the liberty yesterday, Dr. Andy, and scrolled through and looked. And people thought that probably you would have had an overwhelming amount of male listening to you. But I want to tell you, 43% of your audience this evening were women, right? So your advice to the women that they must listen and then take their loved ones to do whatever needs to be done, I mean, was quite apt, because you know us men, we tend to be stubborn sometimes. But really, it really was a great presentation. And you know, one of the things that that came to my mind was that the good fortune of medicine was the loss to the teaching profession, because you brought the points over so clearly in such a calm manner that even persons like I understood completely what you were saying without even making any effort to do so, right? And I'm pretty sure that even persons like PD Eurydice, who don't come with all the tools that you were talking about, being a woman, I mean, even she and others like her followed quite clearly, because your descriptions and your slides and so were spot on. So, you know, I am really happy that even though I joined a bit late, that I joined, because I mean, I learned more in the part of the presentation that I caught than some people listen to an entire presentation. And I saw where even PD Paul wrote to say, boy, it was real enlightening. And I'm pretty sure all of us on here on the platform feel the same way. We realize your knowledge is not only wide and solid in the way you were able to break complex things down simply to us, but you spoke in such a calm, you know, manner that we realize that you mastered not only the scientific aspect of this thing, but also you have the human side of it, the bedside manners they tend to call it. Right? Because sometimes people like you who understand these scientific things at that level will give a great presentation and it goes straight over the head of everybody else because nobody else understood. You realize from the questions that you were getting tonight that everybody was really intrigued by what you said. We got it, and you know, we are really thankful, personal, that wherever you go, you always seek to serve, right? And, you know, we really want to thank you this evening for, you know, being a good human being. You know, I mean, we realize you are a brilliant doctor, very active. Everybody who is in the Kiwanis movement know that you're a very active Kiwanian, because is more than many of us who have been there for years. And we are happy to claim you, sir, as a valuable member of the Kiwanis Club of Kingston. But rest assured, every other Kiwanis Club online, we're willing to share them with you, because we don't keep all good things to ourselves. We're always willing to share. Yes. So we have online, Dr. Andy, a certificate of recognition that we tend to give to persons who come and enlighten us. And believe you me, you have earned this one. And you know, it's displayed online. It says Dr. Andy Jean Baptiste, in recognition of your contribution to the Kiwanis Club of Kingston. And it's not hard to get this one to you because you're right amongst us. So again, on behalf of everyone on the platform, sir, thank you for being with us. Thank you for making what, as I said, was a complex topic seem so very easy. Thank you again.
Thanks
Back
for
to
the
your DP,
opportunity to
Stuart.
present.
Say, oh, I didn't hear that. Sorry.
I said thank you for the opportunity to present.
Oh, yes, yes. It was my pleasure, you know, and I'm not surprised that you did the excellent job that you did. Thank you
Yes.
again. Okay, President Junior, back to you.
Yes, good. Thank you, DP Stew. And thank you, Dr. Baptiste. Excellent. Let us get on. The next item on the agenda is a report of the nomination committee for officers and directors. And that will be done by DLGE Stan Dunwell.
Thanks, President. Before I start my report, this man went to the doctor and said he's having problems in his sex life.
Yes.
The doctor said, but remember, you know, it starts in your head. The man replied and said, that's right, doctor. That's where it is, and I can't get it moved from there.
In his head, right?
Nomination committee.
President Junior.
Yes.
If you notice the time, so I think it's about someone should move for an extension.
Right. I actually for someone to move for an extension of time.
So move. All right, I'll second.
Yes.
Nomination report of the nomination committee 2023. In keeping with Article 3.3 of the Standard Form of Club Bylaws, which operations, one meeting each year between January 1 and May 15 will be designated as the annual meeting of the club. Annual meeting for club elections. At least 30 days previous notice of the annual meeting must be given to members. A nominating committee is appointed by the president. The committee shall consist of not less than 5 members, and if possible, a majority shall be past presidents. The president shall designate the chairman of this committee. The duties of this committee shall be to make nominations with the consent of those nominated and to prepare a ballot for the election of such officers and directors. It is recommended that at least 2 weeks before the annual meeting, that is May 16, the date proposed, nominating committee shall submit a president-elect as sole nominee for the office of president, a list of nominees not exceeding 2 in number for each office to be filled, and a list of nominees for not exceeding the number of directors to be elected plus 3. At least 1 week before the annual meeting, at the regular meeting of the club on May 9, nominations from the floor may be made for any office, and when so made, together with the list submitted by the nominating committee, shall then be the list of nominees submitted for an election of officers and directors. Each officer and director and nominee for the same must be a member in good standing with the club. Any qualified consenting member may be nominated either in advance or from the floor according to club policy. The secretary, unless he is appointed, will be elected at the club's annual meeting by a majority vote. At least 1/3 of the members in good standing constitutes a quorum. Discussions were held with individual members of the committee consisting of DP Chris Robinson, Dale G. William Reeson, Director Warren McDonald, and President Junior Stewart. By chairman, by myself, Dale G. Stan Dunwell, chairman, and the following nominations were made for the positions of President-elect Newton Ramdale, President-elect Vice President Stephen Gregg, Vice President, Garfield Wint. Treasurer, Orville Lewis. Retired second-year directors are Directors David Hall and EP Chris Robinson. Returning directors for first year are Orain Gordon, Errol Hamilton, and Dalma James. And Warren McDonald, plus 2 new directors from the following list. And the 2 new directors suggested are Chairman Andrew Burton and Chairman Arsenio Saunders. This is the report of the nominating committee. Thank you, President.
You're muted, President.
Sorry about that. I was just asking if you have any question on this nominating committee reports. Okay, if not, thank you, DLG Stan, and we will move to our other items. Good, Sarge, it's your time. I didn't look to see whether he's on, but Sarge, are you there?
He's on.
Okay, very much so.
To my Kiwanian brothers, fellow Kiwanians, and everyone present, good evening.
Yeah.
So I'm going to share a story. I know many of us are worried and some of us are trembling, even though we're trying to put on a brave face. Thank you, Dr. Baptiste, for that wonderful, excellent presentation. Now you have these men shaking and quite worried. Hopefully they got to see their physicians. So there was a couple that was celebrating their 50th wedding anniversary. So the wife was slightly hard of hearing. So the husband was giving a toast and he's like, for the past 50 years, I have found you tried and true. So everybody else was smiling and nodding and they were raising their glasses, but his wife, she just had a puzzled look on her face. So he repeated it a little bit louder. He said, for the past 50 years, I have found you tried and true. Again, everyone else smiled but the wife. So he did it a third time, a little bit louder. He goes, for the past 50 years, I found you tried and true. And the wife shot back, yes, yes, for the past 50 years, I've been tired of you too. So out of the abundance of the heart, the mouth speaketh, but I hope we will not find our marriages in those situations, especially with our president, who our first charge is to you.
Yes.
So IPP Paul, we're gonna ask you to pay this one for the sheer forgetfulness and likelihood to cause trouble at home. How could you forget your wife's birthday? $300.
Yeah, okay, what I did.
Is the secretary you have to fall? Fine, not the IPP.
All right, I'm gonna find you for that, Sir Stuart, because I have another charge for the president. I'm gonna give to the secretary.
Okay.
But because you preempted me, I'm gonna give you a charge of $300 as well. So for the president's confusion of Stan and Newton, which we're gonna call failure to properly identify a member, $300. Mr. Secretary, you take care of that one.
Yeah.
DP Richard, for your very core photographic skills. At that joint meeting, that picture that you have posted that we can identify nobody in for shared darkness, $300. And our final charge this evening, P.E. Newton, for your poor audio quality at the beginning of your presentation and your low bandwidth, $300 as well. Have a good evening, everyone.
All right. Thank you, Sam. You have been doing a good job. Okay. We'll move now to notices an announcement and interclubbing opportunity. Dale G. Willie.
Thank you, President Junior.
Yes.
Notices on Thursday, April 27th, we'll be having a fundraising committee meeting at my home, 52 Henny Crescent in Kingston, starting at 6 p.m. We'll be discussing our annual Barbie Fry, which is slated for June the 30th. Just a reminder that Tuesday, May the 16th is our annual general meeting and the election of officers and directors. So reminder as well, the Eastern Canada Caribbean District Convention being held in Quebec City, Ontario from May the 18th to the 20th. And quickly some interclubbing opportunities. We have the Kiwanis Club of Toronto have extended an invitation to us to attend their virtual meeting event with Vice Governor Pam Rodney White tomorrow at 12:15. Tomorrow evening, Kiwanis Club of New Kingston meets at 6 p.m. And on Friday, we have a very interesting discussion on Kiwanis Children Fund. This will be an online meeting and the link will be sent out in the WhatsApp group tomorrow.
Yeah.
Those are the notices and announcements. President Junior, you may ask if there's anybody in the visiting club, they may want to make an announcement. Thank you.
Thank you, Dale G. Willie. And are there anybody else that would like to make some notices or announcement at this point in time from other club studies?
Yes, sure. Thank you.
You ready, see?
Yes. Hi.
Go ahead.
Junior. So 23 Central Story Online, we still have our tickets for that play, Hope for Hopi, to be this Sunday coming up, the 30th of April at 5 p.m. at the Little Theater. Tickets are $2,000, and so please come out and support us. It's for a work.
Yes. Okay, thank you.
You're welcome.
Any other announcements?
Yes, President Stewart, Crystal Heaven here, Vice Chair.
Yes.
For the clubbing from the Kiwanis Club of Montego Bay. So on May 13th, we'll be having our retro party. So you're all invited. We have tickets on sale going for $2,000 pre-sold and $2,500 at the gate. So come over to Montego Bay. It's going to be at the wonderful Caribbean Showcase and it's going to be a blast.
You mean a real party, not online?
Yes, it's a retro party. So it's just going to be fantastic. And we have the famous DJ, one of our own, DLG Ainsworth. It will be the DJ for the night. It's going to be fabulous.
Well, I'll be in Montego Bay and I'm hoping to attend.
Okay, wonderful. And remember, you can get your tickets from me or any other member from the Kiwanis Club of Montego Bay.
Okay, good.
Yes, sir. All right. Thank you all.
And thank you.
All right.
Any other announcement? If not,
Good evening, everyone.
Okay, go ahead.
Hi. The Kiwanis Club of Constant Spring and the Kiwanis Club of North St. Andrew and Papine, in collaboration with the National Blood Bank, will be having a blood drive on May 6th. We're working with the Halfway Tree Primary School between the hours of 9 a.m. to 3 p.m. That's Saturday, May 6th. Come and support and give a pint of blood to save our children. Thank you.
Okay. Other announcement? If not, I'll come back to you, Chairman DP Stewart, for the thoughts. Okay, go ahead.
President Stewart, just to add, DJ Pinches will be another DJ there. So it's going to be DJ Pinches as well as DJ Ainsworth at our retro party in Montego Bay, May 13th.
Okay.
Yes, thank you.
Good. DP Steele, with your thoughts for the week?
Thank you, President Junior. Okay, I have two short ones. First one is on, okay, let me just say what it is. Everyone communicates, but few connect.
Okay.
Connecting is the ability to identify with and relate to people in such a way that it increases your influence with them.
Okay.
And my second, right. Yes, my second is this. I think happiness, and I'll tell you afterwards who said it. I think happiness is about letting go of what you thought your life was supposed to be and just embracing where you are now and how special it is. And this is one of my, from one of my favorite singers in South Africa, Lyra, who about a year ago had a stroke, has not been able to perform since, but is recovering. And I saw this on our Facebook page. So I just thought it was kind of fitting, you know? So those are my two thoughts, President Junior.
Thank you, DP. And at this time, we have come to the end of our meeting. And I just ask everyone on to...
President Junior.
Yes, sir. How are you?
There's an item named any other business.
Oh, AOB. Okay.
I would like to ask President if we have decided on a project for Labor Day, and when will the details be made known to the club?
Okay. Yes, we have decided on a project for Labor Day. We have decided that we would do a project on the blood collection center. We are supposed to be meeting on spot and we have a list of things that are desirous of getting done. So we will be meeting on spot to determine what is there to be done and what we can do for Labor Day. But yes, and it will be hoping that it will be at the blood collection center at our secretariat.
Okay.
Thank you.
President Junior, there was one other thing I wanted to just put in.
Okay.
That next week, Tuesday, our meeting next week, we're gonna have a special guest. Well, all of our guests are special. But this one is Dr. Dr. Lloyd Barnett.
Junior.
No.
Oh, senior.
Senior.
The real Lloyd Barnett.
Junior is not doctor.
Yeah, oh, doctor, that's right.
Right. And he's gonna, we have asked him to discuss this, you know. I'm gonna paraphrase, but the title is gonna be something like, do we really need to appoint a president when we become a republic? Do we really need one? But in essence, that is what the topic is gonna be about. And he as one of the constitutional experts, and he was actually on the committee that was part of that, but he says it's quite fine. He can give his opinion. So next week, Tuesday, Dr. Lloyd Barnett. Thank you, gentlemen and ladies.
Thank you, ladies and gentlemen. So we'll raise our glass and give a toast to Kiwanis International and Jamaica land we love. Thank you all for coming.
International Jamaica land we love.
Okay. Thank you all for coming. It was very interesting, as you all would agree. And have a wonderful rest of the night. Stay tuned for our DJ, DP Stewart.
Congratulations. A wonderful meeting, President Junior.
Yes. Thank you.
That was a goodie. That was a goodie. Tell me something. Why can't a mouse eat a streetcar?
We'll have none of that foolishness. Well, why don't you go fetch the water?
Go do what? Go fetch the water. There's a hole in the bucket, dear Liza, dear Liza. There's a hole in the bucket, dear Liza, a hole.
Well, fix it, dear Henry, dear Henry, dear Henry. Well, fix it, dear Henry, dear Henry, fix it.
With what shall I fix it, dear Liza, dear Liza? With what shall I fix it, dear Liza? With what?
With a straw, dear Henry, dear Henry, dear Henry. With a straw, dear Henry, with a straw.